Hi and welcome to Blue Pigment Podcast. This podcast is to help highlight the individuals that express themselves through creativity. I'm talking about audio forms of art such as poetry, music, singing, comedy, or even storytelling. The podcast usually follows a format where I introduce you to an artist and their creative way of expressing themselves. We then move on to a few adverts which you may want to pay attention to because there could be a discount code in it for you. From there, the majority of the podcast is a discussion with a guest on a form of art and the way in which they express themselves through that creativity. I hope you enjoy the podcast. If you do, please like, share and subscribe. I have a great guest lined up today as it is Endometriosis Awareness Month. I have Maggie Bowyer. She's a poet and a Endo warrior. She is an advocate for endometriosis awareness and an all-round wear your heart on your sleeve type of person. So without further delay, I'm going to now introduce Maggie.
This poem is from my third book, Ungodly, and it is titled PMDD, Meet Endometriosis. I'm not sure if I'm sitting in the midst of the worst of it, the lull before the pain, when you can't feel anything, or if the worst of it is yet to come. The days that I feel everything. Is the worst of it the depression? When I wallow in the consequences of the desolation which I created? Am I emptied because I tossed out everyone I care about? Or is all of this just anticipation? The build-up to my own crumbling, transformed again into a weak body on the floor. Just as the sun begins to rise, the waves of pain begin to invade. Every neuron firing inside of me, burgundy running down my legs, twigs made from splinters collected in the dead of winter. If this crimson keeps bleeding through my insides, I might not make it back to myself in time. I think my depression burst forth from my fear of these days. Depression took hold of an adolescent. Children can't comprehend these kind of bad days. When your own ligaments start to shred your organs, rip you apart at your hips, and snatches your soul as a keepsake. Depression won when the child in me had no fight left in them. Shoved their pain back inside, taped up their burned skin, and tried to pretend it wasn't still happening. Depression won when no one believed me.
Hello everyone, you're listening to Blue Pigment Podcast. If you want to become a patron of this show, please go to patreon.com/bluepigment. You will be helping me help the talent that I find along the way. Not only that, the podcast is an advocate for mental health and the positive message in which we want to send about mental health. So if you are a bit about that and you want to jump on board, then please become a patron at patreon.com/bluepigment. Would love to have you on board. And not only that, you'll get the chance to get some free stuff and be giving another big giveaway soon. To find out what it is, go to patreon.com/bluepigment, become a patron and get yourself some free stuff. Blue Pigment Podcast is sponsored by Huscarl. Go to huscarl.co.uk and use the discount code BluePigment for 15% off. Get yourself some t-shirts, stickers, baseball caps, hoodies, printouts, and many more products from Huscarl. Blue Pigment Podcast, sponsored by Huscarl. Hi, ladies and gentlemen. Welcome to Blue Pigment Podcast. Today I'm joined by Maggie. She's a poet and she's got a big story to tell about her journey. And I'm going to hand you over to Maggie now to give all the information on her. So away to you.
My name is Maggie Bowyer. I am from the United States, and I am a poet, cat parent, endometriosis warrior, and advocate. And I've written 3 poetry books. I am in the process of writing several other books as well, so there's always going to be more. I have been in magazines like Origin Magazine, Capsule Stories, Detour Ahead, Written Tales, Scribe, and more. And I got my start in spoken word. So I will do a little piece for you guys in a little while. But now I do a lot more written poetry and helping people edit and writing essays about chronic pain.
Wow, that's a long. That's really good. I mean, the magazines you've got into, the 3 books you've written. I didn't actually know that before I started the interview. I'd seen the work you've done. Just the poetry alone is fantastic, and I
That's
didn't
amazing.
realize that you did all this other stuff. I need to do a bit more research and check that out. That's awesome.
Thank you so much. Yeah.
Obviously, you mentioned the endometriosis. Just for people that may not know what endometriosis is, I'm a little bit
Absolutely.
aware. It's kind of like an autoimmune disease where blood clots in a certain way. Obviously
Yeah.
you know a lot more about it, but in the UK,
So
1 in 10 women suffer from endometriosis, and
absolutely.
out of that, 30 to 50% of them, it makes them infertile, and that's in the UK. The UK spend 8.2 billion pounds annually on the treatment, the loss of earnings, and healthcare. It's an illness which isn't widely known, even though it is such an impact on females, and it's such an impact on 1 in 10, which is a
Yeah.
lot, and then 1 in 10 of those
Actually,
is. Sorry,
you're
yeah.
exactly right. You shared a lot of great info, so thank you. You know more than most people. Yeah, endometriosis is an illness where cells similar to the lining of the uterus will go and be implanted in different parts of your body. It often is implanted at birth. And so you grow up with it. 9% of fetuses they studied had endometriosis, ones that had passed naturally. And yeah, it's very expensive. My friend and I were just talking, and she's 38 and had done calculated how much she'd spent on endometriosis care in America, and she had spent $924,000 on her endometriosis care. And so it's a huge financial burden as well. The average endo warrior in America spends and or loses 30K a year on endo care. So it's a very expensive disease. And like you said, it's really common. It's as common as asthma or diabetes. The numbers are very similar worldwide, that 1 in 10, 1 in 9 people born female have endo. So very similar across all countries. And it's an extremely painful disease too. You said that it's not very talked about, but it's very taboo, but it's one of the top 20 most painful illnesses the NHS determined. So a top 20 painful illness that 50% of the people who have it contemplate suicide regularly, unfortunately. So it has a huge mental health burden. And like you said, infertility rates are much higher. I love that you mentioned that it is very similar to an autoimmune disease, because so many people think it's simply a reproductive disease, but it can be implanted anywhere in the body, and it's there before your period ever starts. So it really doesn't have much to do with periods, and it's more, like you said, autoimmune, cancerous. It spreads, it grows, like all of those things. So you nailed it though.
My wife has it.
Oh
Luckily,
my
we've
goodness.
been lucky enough to have 2 children, absolutely adorable, and we're blessed with that. But
But it's
like you're
hard
saying,
regardless, so I'm impressed. And endo partners are also awesome, so thank you.
no. So she's in pain like quite often, regularly. It's a struggle every day. There are days that are easier and there's days that are harder. And yourself, with the message you're spreading and trying to send, is an absolutely awesome message, because like we're saying, it isn't that well known, and it should be more well known. And it might be because of like the patriarchal type system that we have, where male and masculinity is quite dominant, and masculine males don't tend to understand it so much. So spreading the message of trying to get as much people to understand it as possible is what we need to do. It's what everyone should be doing. because you might think that, so, you know, one particular day someone's being lazy, and they're not, and you don't
They're just in
realize
so
that
much pain.
exactly, yeah. And it, you know, up there, the top 20 illnesses, painful illnesses, there's no wonder why someone might be like, I need time, I need space,
Mm-hmm.
I need to sort this out, or, you know, or just ride it out.
I can't drive today because I'm basically in labor. I've talked to a lot of people who have had kids naturally, like without any medications, and have said it's very similar to endometriosis pain, if not endo being worse. And that blows my mind, because you're right. People might look at somebody like they're lazy, but really they just need a couple days every month to just lay down and not do anything. And, you know, I used to go to the hospital a lot when I was younger, before I had a diagnosis, because I thought my appendix was rupturing or something. That's how painful it is. You're right.
So what is it that, so obviously you do the poetry, and some of that poetry is aligned to the endometriosis. What it is it about, you know, endometriosis and poetry that, you know, does the poetry help you go through certain things, or how does that sort of function for you then?
Oh, absolutely. I started writing poetry before high school, and I was already having a lot of pain, and I used writing as a very big coping mechanism for anything that was going on in my life, including the physical pain. And, you know, also mental pain. I was diagnosed with PTSD when I was 14, and have been struggling on and off with it since. As you know, it's one of those things you just got to tune up consistently. But it took a long time for me to get my diagnosis, because, you know, I was writing through it. Once I was told it was in my head, I stopped going to the doctor, but I never stopped writing about it, and writing about the pain. And it's kind of been not the evidence that doctors used, but the evidence for me personally validating my story of 13 years till diagnosis. I can look back on these poems and see that I was fighting it this whole time. And going back, like now, I've written a whole book just about poetry on endometriosis. And I really loved writing that, because I wrote it through some of my worst flares. And writing is something you can do on the bathroom floor when you're sick. You can do it in the hospital, on your phone. You can do it anywhere at any time. And I love poetry because, of course, editing might take a little while and a lot of thought power and stuff, but that initial burst of creativity doesn't take the energy away from me, but it distracts me wholly. And I can describe this pain without being overwhelmed by it.
Yeah, I suppose it's that it's the good message as well that you're spreading, of not only telling the people that don't know about it, but also, you know, engaging with the people that do know about it, so they feel, I can relate to that, I can connect with the words that you're using in the poetry. And I now know that there's a larger group, and I now know that it's not just me, and it's not just in my head, and that, yeah, I think in the UK, it's on average 8 years it takes for someone to get diagnosed. You know, my wife was lucky, it was 7 years, but still, that's a long time to go
long time
undiagnosed.
Still, yeah.
Yeah. And then after that diagnosis, the treatment is fairly limited, because it is quite unknown even within the medical world,
under researched.
Yeah. So it'll be good to see people speaking loudly of it to ensure that that this gets pushed. And it is, I mean, there's an element of unfair treatment when it comes to females and within the medical world, I would say. And I think it's like the what I was saying before about, you know, some dominant male dominance and
kind of making it taboo.
Yeah. And even to the point where in certain groups, if you were to talk about you know, the female period, people would be like, oh no, I don't want to talk about that. It's blood, and it's you know, it's unnatural to me. I don't get it, you know. Whereas it's completely natural. It's part of the cycle of life.
Half the people in the world have one, you know.
Yeah, exactly.
But but I get it. And it's such a weird mix of taboo things. And so you're exactly right. Like the patriarchal society, and then how we used to treat people when they had their periods. We'd be like, oh, you have to go stay in your house. You can't leave. You can't be unclean around other people. That's like a lot of historical 200 years ago, etc. But we created that taboo. And then endometriosis also causes, like you said, infertility. It causes pain. It can cause painful sex. All of those things aren't things that we typically talk about in everyday conversation. They're very taboo under the patriarchy or not. I just feel like they're very taboo topics no one wants to talk about. And so it's hard to talk about an illness that's as common as diabetes when no one wants to talk about the symptoms.
Yeah, you're 100% right. It's just as common as diabetes. And people talk about that enough, that I'm not saying they shouldn't talk about that. They should definitely, you should talk about all illnesses the same. One of the things we're lucky here in the UK is we have the NHS. So, we can get treatment for free as and when it's needed. And like you said, that you've spent a lot of money, and your friends have spent a lot of money because of the system that they have in America when it comes to medical bills and so on. But in the same way, being in a Western society, we're still very privileged to have a medical system in place. And I'm just thinking of all the nations that are quite draconian in their methods of leadership and whatnot, and how it must be for a
big system. Yeah.
How it must be for women that have endometriosis in some third world countries, and the lack of education. Yeah. And the lack of education within those countries to tackle that sort of problem. But got to keep spreading your message. Yeah. You're doing a great one.
Absolutely. Thank you so much. And I even think of people in the UK and even Europe when I think about and Asia when I think about endo treatment, because so there's a few types of treatment for endometriosis. Some just treat the symptoms and some treat the disease. So hormone therapy and drugs like Lupron, Orlissa, Zoladex, or any other GnRH drugs, they can treat the symptoms. About 1/5 of patients or less, that's an effective treatment for them and manages their symptoms. And when you come off of those medications, though, often your symptoms come right back if they had disappeared because it doesn't actually treat the lesions in the body. It just masks those symptoms. So then there's two kinds of surgeries that are the actual treatment. So the only way to diagnose endo also officially is through surgery. So you get a little keyhole laparoscopic surgery, and they can either burn any lesions they find, and that's called ablation. And it does lead to higher recurrence rates, meaning you'll have to have another surgery sooner often. And then there's excision. And excision is where they cut the lesions out and they have a much less chance of coming back. But I think about, like you said, all of the people across the world who don't have access. There are only about 200 trained excision surgeons in the world.
Wow.
And 100 of them are in America. And so it's very inequitable to everyone else around the world. I know people who have flown from Australia to America to have surgery, and that should not be the case, And I know that some doctors I know were in Canada where healthcare is better, like more paid for, like the NHS. And they left Canada because they weren't getting paid enough, and they came to the US. And so, it's really hard for people, like you said, in other countries, and then countries that are even less advanced medically than Canada and England and Europe. Like, I just can't imagine how it is in those countries.
Yeah. What would you say to somebody that may be suffering with endometriosis, but doesn't have or feels too embarrassed or anything like that to go and speak to a gynecologist or to go and speak to their doctor and sort it out?
Yeah, I think it's normal to be afraid because of, one, the tabooness, but two, because we're often disbelieved at first, or we're believed and then the tests come back normal and then we're disbelieved. So I would just say, keep fighting, and that your body better than anyone. No doctor who sees you for 15 minutes every 6 months can tell you more about your body than you can. So that's my biggest tip. And, don't not treat your endo just because you don't have access to excision. It's very common in the advocate community for people to shame other people for their treatment choices if they don't have excision. But most of us don't have access to those expensive doctors and flights and all those things. So whatever you do to get through it, don't let other advocates like put you down about what you're doing to treat yourself. I think that you should know that the medications don't actually treat the lesions, and your doctor should tell you that. But beyond getting informed consent, you should do whatever treatment works best for you at that time.
Great advice. Very, very good advice. So you've got a few poems that are specifically about endometriosis. Whenever you're ready,
yes,
please feel free to read one of those off.
Absolutely.
So whilst you're just getting ready for that, I'll just give a website in which you can visit if you are unsure about endometriosis, and it's speakendo.com. Speakendo.com. There are a number of different other websites that you can visit that are full of information on endometriosis, and if you feel like you're struggling or there is something unusual that you're not quite sure about, then don't hesitate to sort of, you know, adventure and see into that.
I'm on Instagram at maggie.writes, and I am always happy to point you to other websites, to more information, connect you with local warriors in the areas you're at. So always feel free to message me about anything endo. And my book, When I Bleed, Poems About Endometriosis, not to plug it, the ebook is 99 cents and will always be 99 cents because there is a fact sheet in the back that talks to you a lot about endo, has websites and resources, has a lot of Instagram resources as well. So I want you all to have as much access to that as possible. So it's 99 cents always.
That's excellent.
And that's US dollars though.
Oh, it's a lot cheaper here in the UK then. So
oh, even better.
yeah. So it'd be, I think it would be about 70, maybe 70 something pence. That's a bargain if you're looking for one.
So I definitely want everybody to be able to have access to that. But if you can't get access to that either, please, like I said, just message me on Instagram, email me, hit up my website, whatever. I'd be happy to help.
The links to all of your website and Instagram account will be on the descriptions of this episode once it comes out.
Perfect.
But what poem have you got lined up for us then, Maggie?
Yeah, I've got a poem called Endo Belly. Figured that was kind of perfect. I learned how to hate my body long before I desired to love my body. A preteen with a bulging abdomen surrounded by judgment, I learned to never give myself the breath my lungs desperately craved, lest my core expand beyond my control. There is a constant reframing process happening in my mind, even as I scan my body for any looming threats. We are at war. I have to remind myself we are on the same side.
Wow, that's powerful stuff. That, especially that last part there about, you know, we're on the same side, because it must feel like you're like angry with your body sometimes.
Yeah, my therapist and I have talked about with my healing my PTSD and like working on that. A lot of my PTSD is from childhood trauma and things like that as well. And we've worked really hard on trying to process certain memories, but we've also talked about how hard it can be to heal trauma when you're still going through it. And so often, luckily, like, you know, I'm out of the situations that caused my PTSD. So often you can get out of those situations, but if you're still going through other trauma, it can be very hard to heal. And endometriosis is regular trauma. And doctor's appointments are regular trauma. Medical trauma is very real. I know people who have gone to the ER with burst cysts and twisted ovaries, which can turn into sepsis and kill you. And they've been sent home. And they had to come back the next day and try again with a new doctor. And that is medical trauma, and that trauma is real. And so it can be very hard to heal that PTSD when you're going through other trauma. And like you said, endo, it's like your body is attacking you. So I think it's really important. Another little tip or advice for people with endo is like, make sure you're doing something for yourself and your body that makes you happy every day, because like your body is doing its best to fight endo. It's not what's the enemy. The endo is the enemy. And your body is putting everything it can into fighting that and keeping you upright or alive or whatever. So it's important for me, like after a doctor's appointment, I go get a special coffee or tea or something, make it a positive. If I'm getting that endo belly, I'm sure you know what that is. Like you get really bloated with endometriosis. And it's so painful and swollen and looks like you're several months pregnant, and which is ironic given the infertility rates. But whenever I have endo belly, I get some nice smelly cream or lotion and I rub my belly and I do a massage on it and things. So it's really important to just like love on your body and give it care, because it's doing everything it can for you.
Yeah. And it's that, the having to repeatedly go back to the doctors in the hospital, which would probably, is going to, if you've got a trauma from that and having to keep going back, thinking that, I'm in a lot of pain, nobody believes me. Am I going to keel over and, kick the bucket in a minute? Nobody seems to care. And that must be quite consuming, like mentally consuming, that, this is all I can think about because I can feel it so much, the pain. What sort of things do you add into your routine to try and reduce the pain?
Yeah, so right now I am waiting on my second excision surgery. So my first one was kind of the biggest thing I tried to do for my pain. But day to day, I lay on an acupuncture mat. I take lots of baths. I eat really, really healthy, all anti-inflammatory, no gluten, no dairy, but everybody's body is different. So don't take that as like what you need to cut out if you're listening. So I eat really an anti-inflammatory, more Mediterranean diet. All of my lotions and stuff I was talking about, like my face cream and stuff, is all homemade. So I know exactly what's going in it, and I'm not getting certain chemicals that could make my pain worse. Just all sorts of things like that. I did pelvic floor PT, so physical therapy for your pelvic floor, for almost 2 years. And that was one of the most beneficial things I've done for my body. Water exercise. Really, it's just finding what kind of exercise you can do gently and support yourself. What makes you feel good body-wise. I think it's very individual, but I also love cupping, dry needling, acupuncture. I always joke, I'm like, somebody sticks needles in my forehead and my neck and everywhere, and I love it. I fall asleep.
Is it like a redirection of pain? Is it like redirecting the pain somewhere else? Is it?
Yeah, and dry needling is very interesting. I don't know, this is kind of an aside, but it's really cool. It's like acupuncture, but instead she sticks the needle in and she massages the knots from the inside with a needle. Right?
Yeah, that sounds
and so
terrible.
you just got a little needle buzzing in your knots, and then they go away. So
there is a strange connection between pain and sort of mental recovery, and that it sounds like it's a negative thing to say, but when I had, I didn't have severe PTSD in any shape or form, but my coping mechanisms at the time when I was a bit, on the fence, like I could tip either way, was through going out and drinking and socializing, and the drink was like a bit of a numbing effect.
It depresses the hypervigilance a little.
Yeah. And also the getting like a tattoo, for example, there is something in it that is enjoyable to feel pain, which especially if it's taking a pain from somewhere else, reducing.
And PTSD, I disassociate a lot personally with my PTSD. And a tattoo pain, it brings you very much back to the present, but it's not super painful, it's like a pinch. And so it really brings you to the present. And I think the same thing. I've talked to several friends with chronic pain about tattoos, and they've said that they love tattoos because it's consenting to pain and it's getting something out of your pain. Whereas like
Endometriosis, I didn't consent to this. I don't know when to expect it. I don't get anything. I mean, that's also part of why I write poetry about it, because I'm like, oh, I kind of get something out of the pain, you know? At least when I come out on the other side, I have 2 or 3 new poems.
Yeah, that's fantastic. It's that growth, isn't it? Sometimes you can grow more when you've been through something that has forced you to grow. And with the growth of the poetry you're doing, it's growth for you and it's helping you, but it's also helping a lot of other people as well. The other thing that I've seen on your Instagram was the cups, the suction cups. I've seen it. I saw it during the Olympics, 2012, like London Olympics. People like putting suction cups on their back. I have no idea how that works and what the benefits of that are.
Yeah, so it's more Chinese, Eastern, Asian medicine, and it's funny, my dad got cupping done and he said it hurt so bad, and he said it helped his arm, but it hurt, and I'm like, I have a cupping set at home, I'm doing it to myself, and it's basically like you'll suction an area, and the real science behind it is more that blood is rushing to that area and healing it and healing that muscular, those knots and things like that. And then part of the more Eastern medicine aspect is that it's supposed to suck the toxins. I don't know about that. I don't know the science on that or anything, but it's supposed to like bring forward the toxins and allow your skin more to handle it than your muscles, because your skin's able to handle those things a lot better.
Yeah. That's really interesting. That I've seen it being done, but I've never really thought about doing it myself. But I can see how it would work with the blood being held in the muscle. There are a number of different. When I do like long distance runs or anything like that, my legs are tired and aching. I wear compression trousers that compress the muscle and they hold the blood in the muscle to help it heal. So yeah, that makes sense. You seem like
it looks a lot stranger though. You take you'll take your shirt off and you got like black marks and purple marks all over your back, and
you seem like the sort of person that is wears your heart on your sleeve. You're happy to discuss your problems with people in the hope to other people to vocalize their issues that they're having or thought processes. And you've mentioned PTSD quite a few times now. Would you like to dive into that?
Absolutely. Anything specific you want me to go into, or just jump on in?
Yeah, jump on in. If there's some message you can give that somebody's been through a similar situation, that'd be fantastic.
Yeah, so I grew up in a pretty neglectful and at times abusive household. And I do have a lot of sexual trauma history and other things like that. And my mom passed away when I was 16. And I had many instances where she was a chronic pain patient, and I did have to be her caretaker for much of my childhood life. And so all of that kind of combined did give me PTSD. And it was one specific moment that really was like the dam breaking of everything, and that my PTSD got really severe, and I got my official diagnosis when I was 14 or 15. So it's been about a decade for me. Definitely had ups and downs in that period. PTSD is not hopeless, but it's also not something that's an easy or quick fix by any means. And it really does, no matter how severe or not severe, I'm putting air quotes for anyone who can't see me, because I'm like, it's not severe, it's still PTSD. It's still hard, it still changes how you function and your day to day. But so I got my diagnosis when I was pretty young. And I did therapy for a while, and it didn't really, talk therapy, it didn't really help. And I stopped therapy for a few years, but I went back probably, oh my goodness, 6 years now. And I started doing DBT, which is called dialectical behavioral therapy. And I think that dialectical behavioral therapy is one of the best methods for treating PTSD, especially from childhood stuff, because it's really about teaching you emotion regulation, teaching you distress tolerance, and then teaching you interpersonal skills you might not have learned when you were younger. So for somebody with childhood trauma in particular, I think that DBT is really good. I also did brain spotting, which is another form of EMDR. I don't know if you've heard of EMDR, but
No.
it's eye movement rapid desensitization, I think is what it's called. And it's basically you have a pointer and the light and music, and you just move it, and you find where, when you're looking at it, feels most activated in your body. So like, do you feel hot in your chest? I get a lot of that when I'm anxious and stuff, the heat in my chest. And so if I feel that getting really intense, I might stop there and just sit and look at that spot for a while. And a lot of memories come up and a lot of emotion and a lot of things happen. And it's supposed to be a way of processing those memories faster and without as much like damage of like having to talk about it and say it out loud. If you don't want to, you can be silent while doing that. And I found that really, really helpful. I still find it helpful. And then the last thing, I'm reading a book called No Bad Parts right now. And it's about parts work and like basically just listening to all the little inner parts of yourself and seeing what they really need, and kind of addressing those needs in ways that you might not have had addressed when you were younger. So all of that is to say those are the things that helped me the most, but PTSD is still something I struggle with 10 years later after diagnosis, and has its ups and downs, needs its tune-ups. I mentioned that it changed my endo journey. I disassociated for many years. I had gone to the hospital for a few years trying to figure out why I was in so much pain, but I got my period when I was 10. And so I started having really awful symptoms of endometriosis in middle school, the end of elementary school. And that's early. And I remember like trying to go to the doctor, nobody would like listen to me and all these things. And so after I got my PTSD diagnosis, I started disassociating a lot. And I stopped going to the doctor because I wasn't aware of my body enough to even know that much was still wrong. I disassociated for about 4 years, like pretty completely. And I remember being a senior in high school, and I just suddenly, I was TAing a class, and suddenly I got this awful chest pain, which I now know is probably thoracic endometriosis, which is endometriosis in the chest. I got this awful chest pain. So I stumble out of the class and I fainted in the hallway on my way to the bathroom. It was like 20 feet away and I couldn't make it. And I remember this guy on the football team, he woke me up. He's like, "Are you okay? Are you okay?" And I was like, "Oh, I'm fine. I just gotta go to the bathroom. I'm fine." And I like run to the bathroom. I'm like drenched in sweat, but I didn't have any warning signs because I was so disassociative that like the pain was increasing and I wasn't taking care of it. And that started to become kind of the cyclic routine of like, I would ignore my pain and then I would faint at work, or I would get really sick and I'd miss 8 days of work. And once I started doing a lot of therapy, we did a lot of body mind work and getting back into my body. And I realized how much pain I was living in every day. All of a sudden, it just like hit me how physically awful I felt. I was in my therapist's office. She said she remembers it very clearly. And this was years ago now. My whole body, like I immediately knew exactly where each pain spot was. And 2 of those spots, they did find endometriosis. So my body, I could feel it, but I just didn't know. And that's when I really started fighting for a diagnosis, was after I came back to my body. And so I still struggle with PTSD, flashbacks, disassociation, nightmares, all those things. But DBT gave me a lot of tools, nightmare protocols, different ways to fall asleep, different ways to deal with disassociation in a crisis, different tips of mindfulness to bring me back. I was cooking yesterday when I noticed I was disassociating a lot, and I was like, stick your face close to the pan and smell those spices, Maggie. Do some mindfulness real quick, like name what colors are in your pan while you're cooking. And that brought me back to myself, but those are tips I learned from DBT. So long-winded way to say that, like, yeah.
It's I could see how. So when I get stressed, sometimes I get like jaw clenched. And you describing, the experiences you've had, and then adding pain consistently on top of that, it must have been an awful experience, especially when, like you're saying, you're disassociating yourself with it and you're not quite understanding exactly what is wrong. And it must have just been quite all consuming and quite stressful. And you mentioning about, getting knots out of your back and the stress and all that, all these stresses, and they have a physiological effect on your body. When you're stressed, it's not just this thing that's going on in your mind. It alters the shape of you. Like if you're stressed, you're going to hunch over more, which is going to give you bad posture. It's going to give you a bad back. And all the things you talked about with the suction cups, the needle,
needles,
little needle prick things. Yeah. Like they're all mechanisms to try and relieve that stress. But knowledge dispels stress. Knowledge dispels fear. The more you know something, the more you know about something, the more equipped you are to handle that thing. So
getting diagnosis, that was so important.
Exactly. Yeah. Getting that diagnosis. There's probably hundreds of people out, there's millions upon millions of people that are out there that are probably undiagnosed, that once they're diagnosed, they know what the issue is. They can educate themselves into how to better cope with the problems, which by you, with your Instagram and your website, your spread, that we just need to spread this more. This is why you're on the show. This is why you're on Blue Pigment Podcast. Is that I will try and reach as many people with this as possible, because that's what.
Yeah, you're doing amazing work.
Yeah, thank you. I appreciate that. So let's go through the website and the Instagram again. Got at Maggie.writes for Instagram and MaggieBowyer.com for the website. Any other places to find your work?
No. I will say, though, that everybody who's listening will get 10% off on my website for any orders. So that's not on Amazon or whatever, but because there's a bunch of different places that sell my books. But if you do order them through my website or through any of the bundles, you can use Blue Pigment, all one word, all caps, and you'll get 10% off your purchase.
Awesome. Thanks for that little discount
Absolutely.
code.
Absolutely.
Perfect. Thank you. Any points you want to add, or any message that you want to spread whilst you've got the airtime?
Oh, I mean, just thank you, first of all. First and foremost, thank you for bringing me here. And second, I want to talk to all the Endo warriors and people who are undiagnosed too, especially if you have mental health issues. Don't take no for an answer. Your pain is real, and when it's real versus a mental health issue, and it can be both. So don't let a doctor say, oh, because you have PTSD, you can't have endo. That's beyond false and silly, but your pain is valid, and it's valid that was hard and traumatic to hear, but you should keep fighting because you deserve a diagnosis for your pain.
Excellent message. Your body is your body. You only get one. Unfortunately, some people have endometriosis, and lucky for some others, some people don't. But that is your body. Look after it and do the best by it that you can.
Yeah.
Hi, thank you very much, Maggie, for coming on. Really appreciate your time. I love the message you're sending, and I'll post this everywhere and every direction that I possibly can. I appreciate it.
Well, I'm sending your wife all of the spoons and love and energy, and I really appreciate your listeners for taking some time to listen to me talk about this, and you for having me on.
Cool. I'm very glad to have you as a guest. Thank you very much.
Thank you.
And yeah, if you're listening on Spotify, Google Podcasts, or iTunes, you can also go across to YouTube and see me and Maggie talking through this as well. Thank you very much for coming on, and I'll speak to you again real soon.
Yeah, real quick.
I'll put it back on record just in case we say something cool.
Yeah, you're good. Keep going.
But it's gone.
It's gone. I was going to say, it's really hard and scary, especially as newlyweds or a young person or trying to have a kid, to hear you have endometriosis and there's almost a 50% chance you might not be able to have those kids. That's so hard to hear. I will say, like, my stepmom actually has endometriosis, and so did my mom. So my family is just full of endo warriors. And my mom had trouble conceiving my younger brother, and my stepmom lost several pregnancies along the way, unfortunately, including 24-month-old twins who were the best brothers and sisters ever. And we now have 2 rainbow babies. So, don't give up and try and find a doctor that'll treat your endo to the best of their ability, so that hopefully you can, have kids if that's what you want, because it doesn't have to not be an option for everyone. That's not to say that there are not some cases where it won't ever be. Like, there are definitely cases it won't be an option, which is very unfortunate and hard. But, there are lots of rainbow babies out there too. So if you have the ability to keep going and keep trying, like, rainbow babies are incredible. I have 2 younger brothers, so.
Yeah. It's good for you that you've got, I know it's not good for you, but having your mother and your stepmother that also have endometriosis, it's good that you have people around you that understand. Because obviously some people don't even understand it themselves, let alone the people around them. So that's you're in a better place.
I'm very privileged in that. It's amazing. Also, if you have a family member with endometriosis, a mother or a sister or close relative, you are 7 to 10 times more likely to have endometriosis. So if you're having problems and somebody in your family close to you has endo, I would recommend going to get looked at specifically for endo to any listeners out there.
Yeah, and especially if somebody's trying for a kid, but they don't seem to be able to conceive a child, and they might not even, some people might not even know I know there's different
some people don't have pain.
Yeah, some
people don't have pain, they just have infertility, and that's another struggle and just as valid.
And this is why the scientists need to start paying this more attention and getting to the bottom of it. But
thank you so much, and I'm so glad that you guys have 2 beautiful little ones. It's so wonderful.
Yeah, it is. It's great. So what's in store for you now then? What's the future?
Yeah, so I'm working on another book. I did just come out with my 3rd book, Ungodly. A lot of it is about endo and being disabled with my other illnesses. So you can definitely check that out too. And I'm just excited to keep writing and connecting with you guys. If you do follow me on Instagram, you'll see lots of updates as things come. And I'm excited. I think that there will be another book at the end of this year if I'm on pace that I think I'm going to be. So keep an eye out.
That's awesome. All right. I think we've done it now.
Officially done, for real.
We've probably done. I think we stopped, then we started again, because it was a real honor to talk to you.
A good conversation. Yeah.
Yeah, really good conversation. Good back and forth.
Thank you for being so open, and your wife. I think that it's incredible when men can step up and be like, let's have this conversation publicly and let's talk about it. And so it really does mean a lot, probably to her, but also to me. So
it shouldn't, though. It should just be normal.
Exactly. It should be normal to talk about, but you doing this helps make it normal. So thank you.
Yeah, that makes sense. Yeah, I think just keep spreading the message. Good job. Appreciate your time, and appreciate you coming on. Appreciate you wearing your heart on your sleeve. Keep doing that, especially about the PTSD, especially about the endometriosis, because the more people talk about what's happening with them, the more it gives other people permission to talk about it. So yeah, thank you again.
Thank you.
Nice to speak to you, Maggie. I'll give you the details of when this episode is going to come out shortly.
Absolutely. I'm sure we'll keep in touch. So
yeah,
thank
definitely.
you.
And keep doing those lives with the poetry.
I will. Thanks.
Thanks a lot. Speak soon. The opinions or views expressed on this podcast are solely of my own or the guests, and do not represent the opinions or views of anybody else or the Ministry of Defence.
Shish kebab, Shawshank Redemption, Chicago! You're out of there!